I like using this anatomical photo to show patients. Essentially, they don't understand how big the tongue is, and many of us don't think about it. We use this in demonstrations with our patients to talk to them about where the trachea is, which is right in this area. And as the air comes down the airway, it's just an obstruction. It's an obstruction that causes an apnea, which is cessation of breath. And as we go further, you can see, what do we do about that? Mrs. Jones, we're worried about you because your airway's closing off. It's just a simple mechanical problem, but it can cause lots and lots of trouble down the road. I can't tell you the number of patients, Rich, that I've seen that have had diagnosis and been told to wear a CPAP, and they really have no idea what's going on with them. They have no idea. They just know they have sleep apnea, and they have to wear that CPAC, they usually call it. They have no idea what it does, and I think it's important for them to be understanding. And what we say basically is you have obstructive sleep apnea, which is an obstruction that happens when you're asleep that causes an apnea. And apnea just means cessation of breath. So as we explain to our patients, it's just a mechanical blockage that happens between the mouth and the trachea somewhere.
You know what I like about this slide, Guy, too, is I've been told I have a big mouth before, but I never knew my tongue was that big. I mean, do people look at that and they think, my gosh, my tongue goes back that far?
You know, what I even do, I put my hand over the bottom part of it, and I say, do you recognize that now? And I can't show that here, but I literally just take my hand and cover up all this part and say, oh, they recognize it being the tongue. They don't realize the tongue goes down the whole collapsible airway. That's why we're here. That's why we as dentists can help identify this, and why we can help treat it.
Good point.
So, what do I tell the patients? Well, look, we move your jaw down and forward. Your tongue's attached to the inside of your jaw, and we open up the airway. Now, this has been photoshopped, and this isn't exactly the way it works, but they get the idea. It works in more ways than just mechanically opening up the airways, we know. But it's important for them to see and understand that that's what we're doing with the dental device. Given the choice between this and a pump that blows open the airway, which is the other most prevalent treatment, most people are going to choose an oral appliance that moves their jaw down and forward.
Absolutely. Let's talk a little bit about who has this out there. In other words, when somebody walks in your office, can you just look at them and tell they have sleep apnea? Or are there things that you look at, that you see, that you think, certainly it makes sense if somebody has a class 2, their chin is real short, that type of thing. That makes sense, but is there anything else that you see that might make us think that they have a problem?
Well, the most obvious answer is obesity. The medical community gets that one. We'll put a check mark on their side for that one. The problem is that they don't see the people who don't have it. But for a moment, we should talk about the obesity, because as you gain weight, what happens is the airway becomes smaller because of the fatty deposits along the lateral fat pads. I hope this isn't the direction we're heading, but it seems like maybe we are, Rich.
I think he's got a super big gulp there at the end. So let's walk through these slides, and we're just going to put each one up for a second. And we're going to talk about how many people in the U.S. are becoming obese. So we have some data here, and you look at this slide series, it's a little bit alarming. It goes back to 1985. We're looking at a BMI over 30. So for a 5'4" person, that means they're about 30 pounds overweight.
And by the way, that means they're obese. A BMI over 30 is defined as what we define as obese.
So the white here is no data. The light blue is less than 10%, and the dark blue would be 10 to 14% of the U.S. adult population. So now we're at 1986. So we're going to kind of walk through these. If we do it a little bit faster, you can actually see the progression. We're getting more and more data. We're seeing less white spaces because we have some data in those states now. We're certainly seeing more darker blue than we are light blue. So we're up to 1989, 1990. Wow, we got a new color here. 1991, we have a new category. 15 to 19% of the population is the dark blue. So this is just what, 20 years ago, right? Right now. So 92, 1993, 1994.
By 1994, literally the whole country is at least 10 to 14% obese, and I don't know what's that, about a third or a fourth is 15 to 19%. Do you think this problem's going away? Do you think there's going to be a job for us in the future? Do you think that it's like they found the fluoride for the obstructive sleep apnea yet? I don't think so. If this is one of the biggest causative factors, which it is, it's not going anywhere anytime soon. Let's go to 96. 97, new category. My home state of Kentucky's in the lead right there where I grew up. So it must be the good cornbread there. New category is 20 to 24% obese. Almost half the country now. 2000. So when did this start, Rich? In what year?
85.
85. So here it is 16 years later, and another new category. 25 to 29%. Over a quarter over the people in the great state of Mississippi, I think it is.
I think it is.
Yes. Alabama's
and
right there.
they're cousins.
Yes.
2003, 2004.
Texas catches up there. There you go, Rich.
Yeah. 2005.
Over 30 now. Over 30. 30 or over. New category.
2006.
Every time I see this, it just overwhelms me. 2007.
2008.
There's no light blue left. Remember when we started? There was light blue and maybe some no data. There's literally no light blue left. This isn't going anywhere, Rich. We're going to have a job for quite some time, it looks like.
So there we go, 1990, 99, and 09. Those 3 decades. I don't know what to think of this. I mean, what do you guys think? What's causing this? Why are we getting so fat?
Brent sent in an answer to that, Rich, if you want to see. We can't answer all the questions as we're going through here, but we'll try to answer some at the end. But did you read what he says? He says it's too many McDonald's and supersized fries, I guess. And
yeah.
I think
we're just too lazy. We're not exercising enough. We see fast food over and over again, eating out, portion size. What else is coming up here?
Something you told me, Rich, is that it's really a sad state of affairs where our country's gotten to the point where we have to pay, how did you say it? Pay someone to tell us how to eat.
Has there ever been a time in the history of the world where we've had to pay someone to make us eat less? Who saw that coming?
Yeah.
Who saw Weight Watchers? Jenny Craig. If you saw it coming and you invested in it, you're doing real well right now. So
this is still coming, and you've got a chance to get invested in it, I guess is our point, because it's not going anywhere.